So where do we want to start, guys? Paula, you told us that you had a kind of a big question come in, and maybe we should lead off with that.
I do have a big question, and then another big one has just come into the chat. So let's start there. The question that came in advance to us is from a care partner who said that his wife has been diagnosed for about a year, and that previously she was highly competent and accomplished in her profession. Now she's in her mid 80s, diagnosed for about a year, I think I said. And she's been fully immobilized by intermittent deep anxiety, intermittent deep depression, and sort of a withdrawal from the joy she used to find in things, people, social interactions. And this care partner is wondering, as his wife has become so dependent on him, he's wondering if there's maybe a few words to help steer him to sources of deeper understanding of what's happening. How can he be helpful? And what can he do?
Jori, take it away.
So I think a couple of thoughts. Number one, this sounds like such a difficult situation, and just to let that care partner know that they are not alone. So first thing is, when I think about someone in their 80s who's only had Parkinson's for a year, this sounds really fast for progression. But what we also know is that individuals who develop Parkinson's later in life, sort of over the age of 70 and later, often tend to progress more quickly than, say, someone who's diagnosed in their 50s or earlier. Not everyone, because everyone with Parkinson's is different, but it is possible that someone is progressing that quickly. And given that, I think that speaks all the more to needing a team that you have faith in, which is, a movement disorders person to tackle the physical immobility, but also can we get a psychiatrist involved? Can we get a psychologist involved? Because it sounds like this person's dear wife is experiencing the anxiety, maybe the depression, certainly the apathy that can be part of Parkinson's. And that apathy and depression, teasing those apart, is someone really sad and that's why they're withdrawing, or do they just lack that motivation to engage? Um, so I think that getting a neuropsychology evaluation could be a great step. If your movement disorders doc, your neurologist can't recommend someone, look around their resources. But that can help tease apart, what is depression, what is anxiety, what is maybe cognitive change, because each of those things we can do something about. So I think number one is hearing that, this is just going to keep spiraling downwards and there's nothing to be done. There's always something to be done. And if the team that your loved one is seeing isn't working on those things, it suggests that we need another team.
Yeah, and I want to jump in there because that's like such the great point, right? If you're new to Parkinson's, if you're newly diagnosed, if you're new to listening here, just know that, and I love Joy, you've said this before, that if a doctor tells you, oh, there's not much more we can do when you go to an appointment, time to shop for another doctor, time to expand your team. And it takes, because Jory will say that she'll tell her fellows when they come into her office that if they say that, then she said, that is the wrong answer. And I love that because that's so important for us to remember. Now, we also know that getting ancillary help, building the team takes time. So guess what? Got to get moving on it as quickly as possible and know that it will take time, but that it's worth it. Start asking around, join Care Partner and Parkinson's support groups because your local community, if you're lucky enough to have one that's active, will have more context for you. I know, Gail, you're a tremendous resource. Pat, you're an amazing resource for people in your areas as well as nationally, but the local areas where you really need help. And Pat, can you talk a little bit about anxiety? Because I know that's been a big issue for Sid in your life with Parkinson's as a care partner.
Yeah, it's a big issue, and we experienced a ton of anxiety yesterday. Things happen in your journey with Parkinson's that you're not expecting, and your person with Parkinson's, they take it differently than we do. Differently meaning that Parkinson's causes the anxiety, and and it's not like the anxiety that you go to the psychiatrist, they give you a pill or whatever, and you work on a program that way, and you learn how to deal with things. But it's an anxiety that they can't explain. But yesterday,
And wait 1 second. So you mean they, meaning the person with Parkinson's,
person with
right?
Parkinson's, yes, that they can't explain. I ask Sydney all the time, why are we anxious? She said, I don't know. It's Parkinson's. And so, I mean, it's a, and everybody's different, like we say, but it's been a roller coaster as far as my experience goes. Our experience, I say our because it's both of ours. But yesterday I went home to a ball. I mean, Sydney was curled up in tears because of a medical program that she was supposed to have done didn't happen because of insurance, and just going back and forth. We thought everything was there and it wasn't, so they canceled it, and she was very anxious going into it. And now it's been canceled. Now we're more anxious because we still need to get it done. And she was in a wreck. And I said, let's stop, let's just stop for a second and look at what we're dealing with. It's going to be fixed. We're going to get the procedure done, and everything's going to be fine. In the meantime, she says, I just need to cry. Okay, so that's one of the things that we have to learn to do is just to let them cry, let them have their emotions
Yeah.
because it's important for them. And for guys, for me, I want to fix everything. So it's a tough thing.
That's
But
great advice, especially in this case where it's a male care
right,
partner
yeah,
dealing with a female. It's true. Sometimes you just need to be sad.
yeah. And so I stepped back and let her have it, and then let her have it her moment, and then we had further discussions, and by the end of the day, we were in a good place, and we have fortunately we're so fortunate with the people we've met and everything over the years, and we were on the phone last night with one of our medical providers, a vendor who's worked with Sydney for quite some time, but he's gone off and he's working in a different modality now. And so, but he just calmed her down. It's just amazing what he was able to do. And so we bring in people and we have a plan, and you get a plan and going. And then I said, why don't you, yesterday when she was going through it, she called me on the phone and we were talking, and I said, just stop what you're doing and go outside. Just go outside and take a breath and get some air. And next thing I know, my cameras were going off because she went outside. I'm I'm still, in fact, they've been
And
going off since we've been
and
here.
Pat does have cameras all around the house. We've
Yeah,
learned that before. But he has cameras in the house too. And this is also
yeah,
another one of Pat's tips in terms of keeping your person company when you're not home
right.
is to have that kind of connection as long as
Well,
they agree to it.
we have a
But
handyman. We have a handyman at the house right now, and he kept banging on the door and ringing the doorbell, and Sydney wasn't getting there. So I went on the phone. I was able to go on to the camera and say, "Hey, you need to give her just a few more minutes. It's going to take her. It's going to take her some time to get to the door."
yeah, I think
And
you've used technology really well.
yeah,
Gail, did you have anything on this topic? And then we probably should jump to the next topic, but
yeah.
there's so many questions in the
No,
chat.
no. I'm fine with.
Okay.
I didn't have that issue.
Polly, where would you like to go with?
A number of questions revolve around Jori's last comment, which was get a new team, find a new neurologist, and questions are coming in. How do we find one? We're on waiting list. There's nobody nearby. Any help there?
I think Connie's comment about asking your local community, connect with your support groups. I will say the latest data, I mean, whoever wrote that in the comments, you're absolutely right. So there are currently 622 total movement disorders specialists in the United States. Some of them are in industry and not seeing patients at all. Some of us do research, so we don't see patients 5 days a week, 12 hours a day. So the number is not nearly enough for the demand. And that said, get on the waiting list. Get
Yeah.
on the waiting list, know that there are cancellations. I will tell you, being in like a large metropolitan area in Chicago, where we are fortunate enough that there are multiple movement disorders centers, people will often call and make an appointment at multiple centers and take 3 slots. And then whoever gets in to see them first, they go to see, and they don't cancel the slot until like the day before with someone else. And then we're calling around on a waiting list. So I don't think that we're alone in this. Get on the waiting lists. And it may be months and months, but it might not be. And it's worth it. If you're not comfortable, ask around, see who other people are seeing. And there may be general neurologists who are terrific, and are specifically interested. There may be geriatricians who are specifically interested.
Yeah.
So
Let me also add that, and I don't know, Jori, in your practice, you have a PA that works with you?
I do. We have 2 physician assistants in our entire practice of 12 neurologists. But there are some practices that have an almost equal number of advanced practice providers, so nurse practitioners, or physician assistants.
And this is what I would say. Try to find a practice that has, yes, nurse practitioners and physician assistants who are also trained, because they can be that expands who you can see. And we found in our experience with my person with Parkinson's that the PA is the one that sets aside the most time, amazingly, and has the expertise, and sort of gets my person. You want a doctor that gets your person, and so I think the MDS training is somewhat essential as far as an overarching understanding, but that there are people under that who've been trained and have been working in that field with people with Parkinson's, that makes your job as a care partner easier, because they're going to, look for these solutions. So look for bigger practices if possible. I realize a lot of listeners are not in a situation to find someone easily, but you can look across state lines too. And I think, again, it's just important. And the same with finding the right type of psychologist or psychiatrist. It's often not helpful to find someone who is not working with either a geriatric population or someone who doesn't understand neuro diseases. And, there are those training, those kind of people out there. But how do you find them? Word of mouth. Or through your GP, and that's where I found support, was through my GP, finding that right therapist. So be creative. I know this is hard. It's hard to take in. It's a lot of work for you as a care partner, but hopefully it reduces your work and your load down the line. Gail, any other thoughts on that, because you're so active with the community here?
Well, I always push for joining support groups, and they have a tremendous amount of information, just tremendous amount. They've been there, they're going through it, and ask them. They'll tell you who they use, and you just put the word out.
Yeah, and then on top of that, it's go to your pedaling for Parkinson's program, go to your boxing for Parkinson's program, or dance for Parkinson's. There you're also, if you're not up for sitting in a room and talking about Parkinson's, there's very many active places you can go, and care partners are always welcome. And you'll be amazed at the people you meet. And the kind of people that go to the exercise programs are the kind of people that will maybe be most helpful and are most resourceful. Resourceful is kind of a key word here.
Yes.
Yeah. Okay, Polly, what?
Yeah.
There's a lot of chatter.
An audience member, also named Gail, says that she knows she should let people help her, but she has a hard time telling people what she needs, because she says, I don't know what I need until I need it, and then it's too late. We've had this topic before, but she asked for suggestions for those of you in the audience or those of you on the panel. And she said she's becoming pretty depressed, and she's taken the caregiver self-assessment and found out she's strained but not burned out yet.
Okay.
Any thoughts?
Yeah, go, Gail, and I have a thought too. Go ahead.
Well, I think when you look at your big picture, there's so much that you need help in that you don't even know how to tease out what someone can do. Perhaps writing some things down on a piece of paper will enable you to choose 1 or 2 or 3 of what you need. But when you are totally snowed under, it's hard to know, where that first shovel will go, because any shovel will help.
Yeah. And so a couple things. One is, are you keeping your family and friends apprised of your person with Parkinson's health status and your and how you're doing, because you want to do that. That's an important consideration in all of this, is not having surprises. So it would really help if you also just sent out a missive, maybe to a couple of your best friends and maybe not even family, because sometimes friends are more helpful than family. And sometimes they're new friends, actually, to be honest with you. And those new friends you might meet at a care partner meetup or another place, but don't be afraid to say, like, I don't know what kind of help to ask for, and you might be surprised that your friends are more intuitive than you think. I would say that one of the things that you need to do is train your person with Parkinson's to accept help, not just you, the care partner. And what does that mean? That means having someone come over and sit with your person, maybe watch TV while you get out, maybe play games, even better, card games, board games, anything, or just have a conversation, do a crossword puzzle, something like that together. You can manufacture, I hate to use the term, but I'm gonna, play dates for your person with Parkinson's that will help you and they'll start to buy you time, because a lot of people are asking about, how do I get more time for myself too? And that's one place to start. And sometimes it's young people. If you have adult children that maybe have flown the coop, but they've left some friends behind that maybe are friends with you and they remember coming over to your house for lively dinners. Sometimes those people can really help. And I know because I've recruited them. I have been going through two broken fingers, and I had one of my son's dear friends is a chef. Guess who I called to prep food? You know, we have a nice conversation, we tell stories, and he chops a bunch of vegetables for me. But it takes asking, right? So it's the asking, and it is hard. I agree, it's hard. Polly?
Yeah. Somebody mentioned that their partner's cognition is changing and they notice more irritability on their part and sleep problems. And I think we were going to circle into sleep today as well. They find it getting worse and the communication is really bad between them. This person asks, is my partner aware of the changes he is experiencing? Will he ever be able to have any empathy for others experiencing life changes?
Mm.
It's a
Jori?
really tough situation, and I hear a couple of different things going on. So yes, we can talk about sleep. Sleep can mess up Parkinson's in just about every possible way, and it can mess up life for our care partners in just about every possible way. Sleep is very disturbed for Parkinson's care partners. But the other thing that this person is calling out sounds like challenges in social cognition, which is how we relate to other people. So if I'm looking, at the panelists in front of me and I see someone kind of like rolling their eyes or something, I'm like, oh, okay, talk too long, right? How we pick up on those nonverbal cues from folks and realize, are we on target? Are we having the same conversation? Are we missing each other? And what we've learned increasingly in the last couple of years is that social cognition changes in people with Parkinson's. And especially people with Parkinson's have a harder time recognizing negative emotions in the person that they're having a conversation with. So you as a care partner might think, this is very clear that I am very frustrated with what's going on. And your voice is different and your facial expression is different. And your loved one may not be picking up on that at all.
Oh.
And that may be like, how is this possibly happening? How could I possibly be clearer? And that is a Parkinson's change that may be going on. And that has not been recognized until the last couple of years. So that is one thing. And the idea of theory of mind, sort of being able to put ourselves, yeah, Connie.
Well, so what would one do in that situation though if they're not recognizing? Let's stop there and then go to the next, because
No, that's
that
great.
is fascinating. So what should we do as care partners in that situation when they clearly aren't recognizing the emotions we're experiencing?
I mean, I think it's another thing to put on care partners to know that this could happen, but then to be able to go, it feels like, or I feel like, right? Use the I statements. I feel like I'm really upset and you might not be picking up on that right now. So instead of relying on those nonverbal cues, you may need to make that verbal. And that could be really hard because for a lot of people, they may not feel comfortable naming those emotions. all the time, but I think that's something, I mean, Pat, you called this out, right? As men, like you want to jump in, you want to fix it. And I loved how you said, we are experiencing this. Why are we anxious? Right? Is
Right.
the I'm feeling really frustrated and I'm more frustrated because it feels like you're not frustrated, right? So calling
Yeah.
that out may be a huge way to just bridge that gap.
One of the other things that I do is I say, I understand this is Parkinson's going on here. And you may not realize that I can't hear you very well. You know, I'm hard of, the other person may be hard of hearing as well. There may be other things going on that distracts to
Mm.
be able to hear the person. But just by explaining, hey, I understand this is Parkinson's and it's also me. And so we need to figure out how to speak with more intent and also listen with more intent.
Pat, do you also find yourself, do you give yourself a timeout then, maybe? Like just to back off or
Um, I, 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 um, yeah, I pretend like I can't hear anything.
well, you and I both have hearing problems, so that and it is difficult for the person with Parkinson's who's speaking more so.
Right. But sometimes you do. Will go and putter around. With our kids growing up, a wise man once told me is when the kids are acting up and one of the parent, and Sydney is working with the kids, then instead of getting involved, go clean the pool.
Yeah, yeah. Do something else
I had a
anyway.
very clean pool for a long time.
But yeah, no, and I think, and then it goes to the sleep part too. So
Yeah.
let's roll back to that because I think that, a lot of us, yeah, we may be sleep deprived, but our person with Parkinson is probably just chronically, it's not probably, but is chronically sleep deprived, right? Or chronically fatigued from their disease. The disease wreaks havoc at every level. That's
Yeah.
something that we've learned. And sleep is something that's so important for cognition, for mood regulation, and just for any kind of get up and go, right? And so how do we, where do we start with sleep, Jory?
I mean, I think exactly recognizing that if you are not sleeping well, everything is going to be affected, right? Everything. Mobility is going to be affected, mood is going to be affected, cognition is going to be affected, all of it. And so that is huge. Talking with, the neurologist, the movement disorder specialist, asking for a referral to sleep specialty to be seen, getting a sleep study, all of that can be tremendously impactful. So if someone has sleep apnea, we were just talking, there was a New York Times coverage about this. Sleep apnea is increased in Parkinson's and is very treatable and is associated with other problems. So like you get multiple benefits if you identify it and you treat it. Right? REM sleep behavior disorder, people acting out, kicking, thrashing, talking, screaming during sleep. We can treat that and prevent people from falling out of bed, getting injured, injuring their bed partners, right? And trouble falling asleep, trouble staying asleep. There's all kinds of things that go into that. And like you mentioned that I tell my fellows, there's stuff we can do. We just
Yeah,
need to know it's happening.
yeah. And what about, is it hard to get a sleep study? Gail, I'll get to you in a second, but a sleep study, is
No.
that hard to schedule? No, not usually.
Depends on where you are. Again, there might be a wait list, but I will tell you, I think people bail on their sleep studies even more frequently than they bail on their movement
Oh.
disorders appointments. So get on that wait list.
The last minute stuff. Yeah,
Yeah.
and I would also say in our case, because Davis does have, and most, gosh, a really high percentage of people with Parkinson's have this REM sleep behavior disorder. That when we moved to individual beds, he stopped having as many episodes of falling out of bed and doing things like that. And I think part of it was he lost his protagonist, who was me. And I was in at risk for getting injured and was getting injured, to be honest. And so I think that sometimes that's just a simple solution to at least try out if you haven't done it. And we were very stubborn in that department. It took a long time. And then I was like, oh, well, this is a lot better. But Gail, did you have something to add to that?
Yeah, I remember when my husband was first diagnosed, I ended up being like a punching bag.
Mm.
And so the doctor said that men typically have dreams about protecting their other, and the women have dreams about running away. So after getting punched, I said, "Okay, what did you dream about?" He said, "I dreamt that I was preventing someone from putting butter on your broccoli." I mean, he knows that butter on my broccoli would like destroy my diet. So he was protecting me. Is that so that men's dreams tend to be one of aggression while the female is running away? Did you ever hear of that?
I've never heard of that gender difference. It tends to be that everyone, they're very active dreams, and it's often that someone is threatening you, your family, someone you
Yeah.
love. And so they're I haven't seen that difference across gender lines,
Yeah.
but most people are fighting someone off, fending someone off, attacking
Mhm.
someone
Yeah.
who's attacking
Yeah.
them.
Right.
I've got some seriously kick butt women, and they have kicked a lot of butt during their dreams. So
Right.
Yeah, I think too, it is amazing how much they remember their dreams too. The last time, we Davis and I were in Europe actually, and the beds are always close together, even if they're separate. And he jumped on me in the middle of the night and he said, "I thought I was catching you. You were a squirrel." And it was very vivid to him, right? And it hurt. You Guess what? I'm not a squirrel. And
Yeah.
somebody did ask about separate. We have separate beds in the same room, which I
Yes.
like. Some people don't want to be in the same room because their person might be making more noise at night, like waking them up too often. But I tend to, if there's noise involved, I'm able to go right back to sleep. So that's lucky for me. But I think that number one, you need to look after your self-care partners. Please make sure that your sleep situation is giving you the best possible outcome. I mean, another difference in sleep as we get older too. I think if we live in a cold climate, Davis can sleep with very light blankets, and I'm sleeping under like two huge down comforters. You know what I mean? So that wouldn't work anyway. But so just do whatever you need to do to sleep better. That's number one, and then help the person next to you. What do you say, Pat? Put the oxygen mask on yourself first.
Yeah. Yeah.
So
I,
number one is you, and number two is then help to solve. And as Jori just told everyone, there are ways to treat the sleep disruptions that people with Parkinson's do have.
honey, can I share one do not do that I
Yes,
learned
please.
from a family?
Please.
I had a lovely couple, and the care partner's solution to her much larger than her husband to try to stop the REM behavior disorder was to get an extra, extra large robe and to try to tether them together with the thought that if they were in like a little cocoon, this would prevent. That does not work. I'm just going to say things not to do. That is a thing not to do. Does not end well. Do not tie yourself to your person with Parkinson's, thinking that you will prevent the REM behavior disorder. That is not going to work. Do not injure yourself.
It feels
So
like
in case that was on anyone's list.
it feels like such a sweet idea, though.
It was so
Waddling.
lovely. When she told me this, I went, "Oh, this is not going to end well, but it's so sweet." I mean, it comes from the best place, right?
Yeah,
So,
right. Right.
Uh,
And I think it's just so important. There is no that I truly believe that so much of the cognitive deficits that people with Parkinson's have, could be alleviated, not gotten rid of, but just alleviated a little bit with just better sleep, right? And it also goes to sleep habits because a lot of our people wake up at night and can't go back to sleep. So they go and they get on a screen, right? They get on Facebook at night. They get on, their phone, and that doesn't help. That's a no-no. We've talked in this meetup before too about using motion sensor lights, and particularly ones that are red, because the red color isn't as disruptive for sleep. And it's a gentler light and won't wake the person up so much. So that's what we have in our bathroom is a motion sensor light. And I think that helps a lot. So there are strategies, to make it safer for your person with Parkinson's, as well as hopefully help them sleep better.
yeah.
Um,
Jury, one of the things is that the person's getting up 3 times a night to urinate.
we're on the same wavelength. So I was going to say, if your loved one is waking up, think about as you're preparing for that appointment with the doctor, with the NP, with the PA, what is it that's waking them up? Right. And sometimes this is really hard to think about because folks will just say, like, well, I got up to go to the bathroom. Okay, but I want you to drill down. Is it that your bladder is actually waking you up? You wake up because you have to pee. Or is it, I don't know why I woke up. I just woke up, but I'm up and I probably will have to wake up and pee at some point. So I'm just going to get up and go to the bathroom. If it's the latter, then like a treatment for bladder issues is not going to help you. But if it's that your bladder is truly waking you up, well, then there are some non-medication things that could be tried, like front loading your day with all of your fluids and tapering off as you get to the end of the day. Double voiding, which is basically go to the bathroom before you do the rest of your routine, and then make yourself try to go a second time right before you turn off the lights. It's like what we do with our kids on a road trip, right? This is the last chance. There's not a travel plaza for 60 miles. Please try to use the bathroom, right? If there's simple things like that. And then there are medications. So if it's your bladder waking you up, we can work on that.
Yeah.
And if it's not, we want to know that so we don't prescribe things that you don't need and that aren't going to be effective.
What did she say? She said we can work on that.
For those in the back.
I changed from one bed, of course, to twin beds, and because I didn't trust my person to be in a room by himself. So I went to twin beds, and then I put one of those railings in between the bed so that he wouldn't be rolling over on my side and then a railing on his side of the bed. So he's sort of cocooned between the two. It made me feel more comfortable, but I did not want to sleep in a separate room. I think I would be more busy listening for some crash if I was in another room. So that worked for us, the two beds together, but yet that bit of a separation. Also, urinals by the side of the bed, so they don't have to get out of the bed, walk to the bathroom, because those with low blood pressure, as soon as they hit the bathroom, that's when they go down. Collapse, pass out.
Polly, where we're at? We're missing a lot in the chat.
A lot of good questions and comments. Somebody said, "What about my person with Parkinson's who never wants to get out of bed?" Any thoughts there? Any experiences from the audience or from you all?
Is that apathy?
That sounds like apathy. And I think apathy is one of the most challenging symptoms because we don't have a good pill for that. I will just be very, very honest. The strategy for apathy is multi-pronged, and it is recognizing that this is coming from the disease, this is coming from Parkinson's itself. This is not your person not being grateful. This is not them being stubborn or not appreciating everything that you're trying to do, even though it can very much feel like that. But having some kind of individualized daily schedule, make the doctor the bad guy. So I tell people, like, this is a contract, and I might want you to do 5 different things in a day, and there are going to be days where that's fine, and there are going to be days where you don't want to do any. But we're going to agree that you at least do 2.
Yeah.
Right. And then care partners can help reinforce that, but throw the doc under the bus so that you don't have to be, the bad guy, the bad person.
Yeah, and our Dr. Mark Mapstone, who's been with us a number of times, who's a neuropsychologist, has talked extensively about apathy. And you're right. I mean, obviously you're right, but it's talked a lot about the need to schedule. So think about that. If your person doesn't want to get out of bed, but guess what? We have a 9 o'clock. You need to be at Pedaling for Parkinson's at 9 o'clock, or you need to be, or I need to be somewhere. So I need you to get out the door with me. Having a schedule is really important from what I understand. And I haven't experienced apathy firsthand, but I have heard that that's the most helpful. So it's not medication based. And I think if you get your person up and out, they might be, maybe that helps as well. And the exercise for sure helps to sleep better. We've recently been experimenting with magnesium. What do you think about that, Jori? Because it kind of calms the muscles down a little bit. So I think that
I think it's one of these things that probably, unless you have a cardiac problem, a kidney problem, where you have a hard time regulating electrolytes and things. So if you have any of those issues, talk with your treating healthcare professionals before, adding anything, including supplements. I think there's not a ton of great, rigorous research around it. And that being said, there are a ton of people who are using it. So, for some people with muscle cramps, especially those early morning Charlie horses and things, some people find magnesium really helpful, either taken, by mouth, sometimes helpful for sleep. Sometimes there are some like muscle balms that people just rub on, where they tend to get crampy, and those
Oh,
can
right.
be helpful. But I think it's very individual.
Okay. And also do some research on it because there's many different kinds of magnesium too. And then, figure out what time you need to take it or if it works at all for you. And again, it's, we've seen a lot in the social media about that.
Yeah, we have
Holidays.
we have one more question.
Okay.
Somebody asked. It's a kind of a brave question, and
Okay.
you may not feel comfortable answering this, but maybe before we get into holidays.
Okay. Holidays will be the last. We're going to get to that.
Yeah, this person said my husband's Parkinson's is well advanced. His pleasures are food and sex. Food is easy, but I have a hard time being turned on by this man, so diminished from the man I married 46 years ago. Any suggestions? Yeah.
Well, I will say this is not a lone or rare feeling. This is really, really common. And I hear this a lot from my brave care partners, and it's probably out there even more from folks who just don't feel comfortable enough saying it. That change in relationship from partner, spouse to care partner, care recipient is a huge change. And we don't acknowledge that often, but that's a really big change, let alone all the physical changes. And if someone is drooling, if they're stiff, if they're all of it is different. That social cognition piece, they're not picking up on the cues. So all of this, I would say one strategy is think about intimacy as more as a broader kind of approach than maybe what it used to look like. So holding hands, giving each other a massage, being together, enjoying things, in other ways, just physical touch that's, outside of the bedroom. But also, if there are times, I see this with a lot of my folks, is as a movement disorder doc, we will time the medications because most people don't need their dopamine stimulation overnight for the most part. So we time things to kind of taper off as you head towards bedtime. But that means that if you are planning to be intimate only around bedtime and your levodopa or your meds have worn off and you are stiff and slow and immobile at bedtime, that is not going to be an ideal timing to be intimate, right? So either pick a different time of day, or be brave, tell your prescriber that you need those meds to last longer. Seek out counseling, seek out sex education, sex counselors, marital therapists. I think all of those are part of the toolkit.
Yeah, that's always been a really hard discussion because it is talk about individual specific, and we're also different in that in terms of intimacy anyway. But I think too, it's the what you said, the physical touching and changing the way we view intimacy can really help. And also be careful that the person isn't on an agonist, right? Because sometimes there are medications you can take that will make you hypersexual. It'll make your addictive behaviors ramp up. Talk to the doctor if this is a new behavior, and especially talk to the doctor if you're uncomfortable with it. And sometimes it's just a phone call. You don't have to wait for the appointment. You call them and tell them you feel it's urgent. By the way, I think a lot of us are unwilling to express urgency when we try to make appointments. And so this is urgent. And I think that too, if you can't get through to your movement disorder doc, you can hopefully get through to your general practitioner who might also be able to help you with some solutions. And, we're very fortunate in my husband's neurology practice that it also is partnered with both of our GPs, and they actually talk to each other. So this is incredible. And that's rare. I know that, but it's important. So I want you to think about that too when you are looking around for other people to find support and get answers from. But do look at the medication list. And can we jump to sort of happier, but also hard times, which is the holidays. The holidays are coming. The goose is getting fat, and and some of us are really stressing. So, Gail, I want you to kick it off. And I know, Jori, you've got some thoughts. Go, Gail.
Well, what do you do when you love to entertain, but you don't want to be bothered with all that fussing? for cooking. So what I suggest, it's early enough, go to your local markets and sample some of their future holiday foods, like their mashed potatoes, their green bean, whatever. Uh, Check out Trader Joe's has great cranberry relish. Sprouts has wonderful. Jory, you're laughing. Sprouts has
We live on
great
Trader
mashed potatoes, red bliss mashed potatoes, and I add a little cream to it, sour cream and milk, and they're wonderful. Check out your local stores and make a mental note, and a few days in advance speak to them and tell them what you need. You don't have to worry about someone asking you for your recipe, because they will congratulate you on locating what you have, and make it easy. Go and get pre-bought what is that, chickens that are on the spit. People are
Roasted, yeah,
there not because this
pre-roasted.
is going to be their last meal. They're not on death row. They want to have a social event. So there's no reason to be a slave in the kitchen and feel all guilty, because it's more than just cooking. It's shopping. It's taking the stuff out of the car. It's prepping. That's all time that you can have for yourself. And if you do your research in advance, I have even at times brought my own pan to some of these markets and said, can you do, let's say, the lasagna, whatever it is, can you make it in my pan?
Hmm.
Oh, Jory, I have all the tricks.
That is brilliant. We
And
need a
then
book from Gail.
yeah. And then when your guests come, you can deal with your person with Parkinson's, but you can be much more relaxed, and you can go back and have social events at your home, something that you just avoid like crazy. So if you want some of the grocery store recommendations, you can get in touch with me. But Sprouts, Trader Joe's for those two things, and anywhere that Costco has chicken on a spit for, I guess it's $9 or something.
Oh,
So,
it's
and I
great.
want
Yeah.
everyone to know that Pat and Gail are ambassadors, and you can reach them through the
Yeah.
Davis Phinney Foundation. So, if you need those tips, I think that's important. I think my number one tip for the holidays, I just want to throw it out there, is to make sure you've sent that holiday letter to all the people that you care about that tells you, how are you doing? And not just bragging about what your kids are doing or not doing, or the grandkids, but tell them how you're doing and how your person with Parkinson's is, and let them know the challenges you have faced and are facing. And you will be surprised what comes back in return in terms of help, because we humans are hardwired to help each other. Don't forget that. We may also be very selfish, but we really are hardwired to help. So again, get out there, let people know how you're doing, and ask for help. Jory, I know you've got a few tips. Pat, I'm going to let you think about that, and we'll get to you too.
I think so. I think there are two phenomena that can happen in some families, and sometimes both happen simultaneously, that can be really, really challenging. One is this idea of spotlighting, which is where you are caring for your loved one. You see them, the ups, the downs, the day to day, and family who hasn't seen them for a long time may come in, there may be the event, and the person looks great. They are way above their baseline. They look fantastic. And the feedback that you get from these other folks is like, I don't know what you're talking about. Dad's fine, right? Grandma looks fantastic. Like, what? I don't know why you're complaining, why you say you're so tired. Look how great he's doing, right? We call that spotlighting. This is the same thing as when the person shows up to my office and they take off and they walk down the hall and they swing their arms, and the family's going, you don't walk like that, right? This is not intentional. That's number one. People are not trying to show off and prove you wrong, right? But there is that capacity to kind of rise above, and it doesn't last, right? So as soon as Thanksgiving is over and the last person leaves the house and you're stuck with the cleanup, your loved one may crash not only back down to their baseline, but even lower than that from that effort that they exerted. You are not crazy. You are not alone. This is very real. That's number one. The flip side of that is that there are also maybe family members or friends who have not seen your loved one in quite some time, show up for the holidays and go, oh my gosh, they look so different. I notice all this change. Have you looked? I looked on Google and I found this article that you should be looking into, or have you tried this thing? Right. And kind of what I hear from care partners is it just kind of steamrolls past the like, yeah, this is our day to day. We've been living with this, but thanks for jumping in and thinking that you have all the answers
Yeah.
right now. recognize it comes from a place of wanting to help, but also recognize that you can take that advice and just put it on the shelf with everything else that you want to regift. It can just go right back out the door if it needs to. So both.
And can I also add, when they come in and say how great your person with Parkinson's is doing, I immediately divert to me. I'm like, what about me? Give me a little kudos here. But and it's always, it's actually a good point of humor. But also, I'm like, come on.
Yeah, Connie, it's like Davis is doing great, but Connie, why do you look so tired?
Exactly. Exactly. So don't be afraid to just ask for a little support.
Yeah.
But by the way, I want to draw everyone's attention to what Bruce McWilliams has also written in the chat, which is just lovely. Bruce has been with us before as a guest, and he has 6 ways to deal with difficult family members. And I think it's really wonderful, and I think it's something to consider. I think that we need to all have compassion at this time of year and in the chaotic times that we live in. So compassion is number one. Keep your boundaries. So again, if they come in and they start to criticize how you're caring for your person with Parkinson's or how you're caring for yourself or your home, put the boundary up, fence line created. I think that's really important. And, you can maybe after the fact, I don't know, Bruce, when you examine your reactions to their behavior, but maybe after the fact. But in the meanwhile, just sort of, try to be, take that deep breath and recenter yourself. I think that's really important too. And most important is not to engage with bad behavior from family members. Just sort of, pass it out, pass the appetizers and let it run off of you. But I think too, it's the ideal family is the one you create at this age in our life. And on the holiday, we had some friends come over and we had a few family members and this past holiday, and it was so raucous and fun and lively, and it's the family you create sometimes. So make sure that you're the architect of who comes into your home. So make sure you know that too. And when you go to other places, be picky about where you go and why you go there, right? Like, just remember that. Pat, you got anything? We haven't heard from you for a couple minutes.
Yeah. My favorite grocery store, by the way, Gail, is Amazon. If you go to grocery delivered today, some of the best produce you can get the freshest produce I've got.
Right.
And the prices you can shop for pricing too. Anyway, it's a new trick that I found. This is the time of year that I like to go back and start to thank people, to send out messages of thanks, checking in with other people with Parkinson's, see how they're doing, and kind of being the care partner to others, and bringing some light to their experiences if possible, and but also thanking all those that have been in parts and that have helped us out in our lives. And so it's I don't know.
Well, let's encourage everyone to do that.
Yeah.
That's your assignment right there.
Well, it's and it doesn't have to cost you any money either. You just make a phone call, or you can send. One of the things I've done is I'll go to the grocery store and buy up. I just bought $250 worth of Dairy Queen gift cards. And send out ice cream. One of our good friends, Carl, one of his favorite treats was ice cream, and so that's something that I try to do. I know that all the grandkids get ice cream for their birthdays now from Dairy Queen.
Yeah, perfect.
But
Perfect.
thanking those people around us, that's.
Yeah, I think expressing gratitude, keeping people informed, setting the boundaries, and having most of all having compassion for yourself.
Definitely.
And Gail is the best at reminding us that we're doing the best we can. And while we might like other people to thank us for taking care of our person with Parkinson's, it's kind of rare that we actually hear that. So you're hearing it right now from us. right now. We're so grateful that you actually took this hour to be with us and listen. We're so grateful for people like Jori out in the trenches, really working with our community and doing research for the community, and helping us to live better. That's what it's all about. Polly, I can't thank you enough for all you do for the Davis Phinney Foundation, keeping us going and being so active and so kind and compassionate. I don't think anyone could ever find a more compassionate leader in the space than you. It's truly true. And we have angels among us. Pat and Gail continue to do this work. Gail lost her husband more than 5 years ago, and she's still such a leader in this space, and it's so important. And so for all of you listening, I mean, it's the time for you to find this kind of help. Don't hesitate. Look, ask. We want to help. We want to be there for you. That's just the human spirit. And I appreciate all the hearts that are coming up, and their hearts for all of you guys, and everyone listening, and everyone talking to each other in the chat. This is how we get by. This is how we thrive. We don't just get by, we thrive. Best we know, this is our one shot to make it the best possible life we can. And Parkinson's is a thorn in all of our sides. We are grateful for people like Jori helping us, and Polly, but we are impacted every day 24/7, and so is our person. And so we're just doing our best. Anybody got anything on top of that? Any more icing on the cake, people?
I hope you saw the comment that said, "This is my family of choice."
Yeah.
Thank you, Connie and Davis and Polly, for making a community where that is what's in the chat. That's amazing.
Thanks, everyone. Happy holidays. Happy New Year.